Hello and welcome to Eat, Move, Think. This episode we will be talking about genetics and longevity. I'm your host, Allison Hazell. I'm the Director of Clinical Innovation at Medcan, and I'm joined today by Jessica Gu. Jess, would you like to introduce yourself?
Sure. So I'm Jessica. I am the Clinical Director of Genetics at Medcan and a board-certified genetic counselor here. So today we're going to be talking about genetics and longevity with a real focus on a gene called ApoE.
What is ApoE?
So this is a really great question. ApoE is a really well-known gene, and it has a lot of implications in various health conditions and most recently in longevity. To break it down a little bit, remembering back to high school biology, we all have 2 copies of all of our genes. So everyone has 2 copies of the ApoE gene. And the ApoE gene comes in 3 alleles or 3 varieties, and we call them E2, E3, and E4. The E3 allele is the most common one, and most people have 2 copies of the E3 allele. And things get a little bit more interesting when we start talking about the E4 and the E2 alleles. The E4 allele has been shown to be a risk factor for heart disease, late onset Alzheimer's disease, and through that association may decrease the chance an individual will have longevity. Whereas the E2 allele appears to be protective. So people who have at least 1 copy of the E2 allele have a lower risk for heart disease and late onset Alzheimer's disease and a higher chance of achieving longevity.
When would somebody get genetic testing for ApoE? Is it a pretty common thing to be tested for, or is it?
It is a common thing that people are interested in because it's such a popular gene, but it's actually a gene where genetic testing is really limited because it doesn't give comprehensive information. So what I mean by this is we've talked about how we don't understand the mechanism of the ApoE gene and how it relates to these conditions so far. But additionally, it's only one of so many different factors that play a role in all of these traits and health conditions. As an example, even though the E4 allele is a risk marker for late onset Alzheimer's disease, studies have shown that over 40% of people with late onset Alzheimer's disease don't have the E4 allele. And so it's not explaining why over 40% of people with late onset Alzheimer's disease have the condition.
Okay, so it's not deterministic. It's kind of one risk factor of many, and many of which we may not understand still.
Yes, exactly. It's one piece of a very large puzzle.
Given that it gives you some information, but not everything, like why would somebody seek out genetic testing for ApoE?
It's a good question. And I think it boils down to how much information a person wants, understanding the limitations of that information. At Medcan, we actually offer ApoE testing as part of what we call whole genome sequencing, where we look at 4,000 genes. And this is a much more comprehensive test because it includes other hereditary causes of dementia. And it's meant to give clients who are interested in this information as much genetic risk information as possible that is not limited to one piece of the puzzle for one health condition. Some people who choose to do whole genome sequencing might want this kind of information to help them with life planning or just to help them understand what risks they should be aware of for themselves and for their family members.
So along that lens, if we sort of zoom out a little bit, thinking about genetics and longevity broadly, how much of one's longevity is determined by your genetics? Do we know that yet?
When we try to determine how heritable a certain trait is, we tend to look at twin studies. So looking at identical twins and seeing if one twin has X, does the other twin also show that same trait? For longevity, studies estimate anywhere between 10 and 30% of it is hereditary or heritable. Okay. So the ApoE gene is not going to be all of that. It's one of the many genetic factors that contribute to the heritability of longevity. But that also tells us there's a significant portion of longevity that isn't due to our genes. Part of that is probably lifestyle factors as well.
Okay, so thinking about lifestyle changes, what are some examples of lifestyle changes that can have an impact on ApoE, kind of impact of ApoE status or longevity generally?
Yeah, it's a great question. So Given that the ApoE gene codes for a cholesterol receptor in the brain, we generally recommend heart and brain healthy lifestyle strategies. So a lot of people are familiar with heart healthy lifestyle strategies. These include things like a balanced diet, regular cardiovascular exercise, stress reduction, alcohol in moderation. But we add to that these brain healthy lifestyle strategies to promote brain health specifically. These will include things like mental stimulation, regular social engagements, a really healthy sleep cycle, and just making sure that you have, in general, an environment that fosters your brain being healthy and recovering at night from things that it can accumulate during the day.
So when we're thinking about something like Alzheimer's disease, amyloid has been often kind of discussed as a pretty important factor. How, that piece about sleep, what do we know about the relationship between sleep and kind of amyloid specifically?
Yeah, so amyloids are these proteins that can build up and form plaques in the brain, and these plaques can be markers or even precursors to various forms of dementia. When we sleep, our brain takes the time to clear some of these amyloids and plaques out. And during the day, they can develop. So the reason we promote a healthy and regular sleep cycle is that so your brain has time to remove as much toxins and plaques as possible, and therefore try and reduce some of that risk of Alzheimer's disease and dementia.
So, thinking about ApoE4, I know I've seen personally some headlines lately around people have had testing for it. What would you say is kind of a good candidate for someone who's interested in testing for something like ApoE?
Yeah, so I think that sometimes when you read articles or opinions about ApoE online, they may not reflect the most up-to-date and accurate medical information that we have about it. Like I've said, ApoE and the E4 allele are only a piece of the puzzle when it comes to late onset Alzheimer's disease. Over 40% of people with late onset Alzheimer's disease don't have that risk marker. And many people with that risk marker don't develop late onset Alzheimer's disease. So it is a risk marker, but it is one that, like I said, lifestyle strategies may help mitigate some of the risk for. I think that someone who's interested in this kind of information, who wants to use this kind of information to make lifestyle decisions or other decisions about their health, these are the right candidates to consider, whether it's ApoE testing or our whole genome sequencing. People who aren't concerned or anxious about this kind of risk information are the best candidates for it, and who understand the limitations of the testing.
So you talked about how ApoE is one of the genes that's included on whole genome sequencing that we do at Medcan. Is there a scenario where someone would be better off just looking at ApoE, or is it, is doing it in the context of whole genome sequencing preferred?
So there are so many different genes that are implicated in dementia. Most of them will be hereditary forms of dementia. And hereditary forms of dementia are ones where lifestyle may not be able to mitigate risk, where that gene can very significantly increase your risk, or sometimes even almost guarantee the chance that you would develop dementia. So these hereditary forms of dementia are very different from late onset Alzheimer's disease, where the ApoE4 risk allele is only a piece of the puzzle. So they're actually quite different types of conditions and risks that come out of testing for these conditions. And if someone only wanted information about late onset Alzheimer's disease specifically, right now, the genetic testing really centers around the ApoE gene. However, it's still one of many genetic factors, known or unknown, that contribute to the condition. So I think that genetic testing will only get better for late onset Alzheimer's disease as we learn more about what other genetic factors contribute to the condition. I think that ApoE testing is something that people should consider if they understand the limitations of the test, but it's not going to give a comprehensive picture.
One other question I have around ApoE specifically is the link to cardiovascular disease. You talked a little bit about kind of the cholesterol mechanism. Do we see genetic testing for ApoE being used in cardiovascular disease space, or what other kind of use cases would you see that?
I think there's even been proposed cardiovascular genetic testing panels that include the ApoE gene for this reason. With regards to high cholesterol specifically, there is something called hereditary high cholesterol, where people, regardless of what they do from a lifestyle perspective, have extremely high levels of LDL, or the bad cholesterol. The ApoE4 risk allele doesn't cause that, but does seem to increase the chance of generally elevated cholesterol levels. And so there can be a space where information about the ApoE gene and which variant or which allele you have can help you understand your heart disease risk, whether you're more likely to have higher levels of cholesterol, potentially more likely to need a cholesterol-lowering medication like a statin. And that can be helpful in a general precision medicine initiative. And so I think some testing from a heart disease perspective may include the ApoE gene in the future. But one of the important considerations here is that that gene may inadvertently give you information about something else, like late onset Alzheimer's disease. So it's important for people to know about what's being tested and what other implications it could have for them.
If somebody knows their ApoE status, then, how do they use that information, or when should they talk to their healthcare provider about it? How does it kind of show up in the interaction with their clinical team?
So I think that your healthcare provider, especially your primary care provider, should be aware of any relevant test results as soon as possible. With ApoE specifically, it's associated with late onset Alzheimer's disease. So if you're 20, maybe it doesn't have any immediate impact on your care, but it still doesn't hurt for this to be part of your general conversation with your healthcare providers. The main thing we recommend right now is lifestyle strategies to modify your risk. So there is what we call a jar model of inheritance that was, I believe, originally proposed by a genetic counselor named Janine Austin. And essentially, if you picture a jar and it has some marbles in it, these marbles represent the genetic factors that you are born with. Mm-hmm. So genetic risk for any particular health condition. Some people may have very few, whereas some people may have an almost full jar. We can't change our genetic risk factors. They're inherent. But what we can change is the environmental factors or other risk factors. So this is where lifestyle comes in. There are lifestyle strategies that could lower your risk, and we represent that by making the jar taller. So a heart healthy or brain healthy lifestyle might make that jar taller, so it's less likely to be filled. And when the jar is filled is when someone will develop symptoms. On the other hand, things like acute stress, isolation, severe heart disease that goes untreated, these can introduce other types of marbles that will help fill up the jar and increase the risk of symptoms beginning sooner than later. So this is where lifestyle strategies, regardless of the genetic risk factors you've been born with, can still mitigate that risk.
All really helpful information for people who are interested in this and potentially exploring doing something like whole genome sequencing. What's the next step for them? What should they do to determine whether it's a good fit for them and pursue testing if they want to?
Yeah, they're welcome to reach out to the Medcan genetics team. For all of our genetic services, a client will always meet with a genetic counselor prior to initiating genetic testing in order to understand the testing that is being done and make sure it is that right fit for them before they proceed. So if someone is interested in whole genome sequencing, we're very happy to have that conversation with them and answer any questions they have.
Well, thank you so much, Jess. It's been wonderful to chat with you about this today.
Thank you for having me.
Appreciate your expertise in this area. And for anyone who's interested in learning more, there will be some links and notes in the show notes. So feel free to check that out and reach out if interested.
This podcast episode is intended to provide general information about health and wellness only and is not designed or intended to constitute or be used as a substitute for medical advice, treatment, or diagnosis. You should always talk to your Medcan healthcare provider for individual medical advice, diagnosis, and treatment, including your specific health and wellness needs. This podcast is based on the information available at the time of preparation and is only accurate and current as of that date. Source information and recommendations are subject to change based on scientific evidence as it evolves over time. Medcan is not responsible for future changes or updates to the information and recommendations and assumes no obligation to update based on future developments. Reference to or mention of specific treatments or therapies does not constitute or imply a recommendation or endorsement. The links provided within the associated document are to assist the reader with any specific information highlighted. Any third-party links are not endorsed by Medcan.